all of you. He's a great friend and someone we're pretty much the same age. I've looked up to for a long time. Sumeet first came to the States when he was a medical student in India, took a rotation in Boston, and he tells me that his mother still believes he's still rotating. His father wonders why he used the return leg on the plane ticket. He did his cardiology, general cardiology training at the University of Minnesota, and then went to the Mayo for electrophysiology, and then has been on the faculty at Oregon Health Sciences University since then. He's an associate professor of medicine and director of the clinical electrophysiology program, and I forget the title of the arrhythmia research program. He directs that too. I stumbled on that. His work has bridged everything from molecular biology to epidemiology to clinical arrhythmia work, and I think the talk today kind of show that breadth and hopefully makes us all a little bit smarter about how to assess the risk of sudden death in our patients. Dr. Chu.
Good morning. Mark, thank you. You know, if you want to look good, just have a friend introduce you. It works every time. You know, Mark knows this, but I cannot tell how much Oregon Health and Science, Ms. Mark Bossler, Bill Getchell, and Cosimo, we just met again. We'd have them back in a jiffy, only we know that they love their environment here. I must say, I've been so impressed with Evergreen, the setup, and what Mark and his partners are doing. I tell you, it's cutting-edge cardiology. We need to be really proud of Eastside cardiology. I'm truly very impressed. So very honored to be invited here to meet you all and to talk a little bit about something that I'm very interested in as a clinical cardiologist. Cardiac arrest, and for any healthcare provider, I would say, is a black box still. And so it is fun to try to tease out some of the reasons why this happens. I would say that, never hurts to start with defining any entity. So what we think about sudden cardiac arrest is that it's a sudden, unexpected loss of the pulse. And most of the time, it's related to something that's going wrong with the heart. And if we think we're smart, there's always somebody before us who recognizes that. So, the Papyrus Ebers, if you look back to the earliest reference to cardiac arrest, say that, and of course I have the distinct advantage that maybe, I'm not sure maybe you can read what's on the left, but take my word for it. They say that if the heart trembles, has little power, and sinks, the disease is advancing and death is near. And why does death come near when you have this situation? Well, you have this, at the bottom, you have this kind of rhythm issue, which we call ventricular fibrillation, potentially starting out as ventricular tachycardia, becoming ventricular fibrillation, and then, of course, not much going on. For every minute of this, there's a 10% less chance that we're going to make it. So the math is easy, 10 minutes, and it's curtains. But the problem is, what causes this? Well, I would say the gorilla in the midst of all this is coronary artery disease. We know that. At least 80% of all cardiac arrests happen to people who have severe coronary disease. Well, there's a sizable number that we sort of qualify, categorize into cardiomyopathies. We're increasingly recognizing that what we used to call idiopathic dilated cardiomyopathy many times can be a mutation that runs in a family, for example, the lamin gene. And then, of course, you have hypertrophic cardiomyopathies. And then, last but not least, there's sort of less than 5% are these zebras, but they're important zebras when they're in your clinic or on your ward, because it can be long QT syndrome, it can be Brugada syndrome, and it's a moving target as we learn more and more about these syndromes. One fact, as biased as I am, I think it's difficult to deny, is the fact that show me a disease condition that has a 95% instantaneous mortality rate. I would challenge you to come up with that. And I don't think there is one. You look at the worst cancer, you won't find that.